Okay, we're going to get started here. So, hello everyone. My name is Kevin Nelson, and I'm the Marketing Director here at Enterprise Health, and I want to welcome you to today's 30-minute webinar sponsored by Enterprise Health. We do appreciate everyone's time today. We know how busy everyone is right now, especially as you continue to navigate the ever-changing COVID situation. And that's precisely why we design these webinars to be fast and focused on a single topic. In most cases, emphasizing new or innovative functionality developed to support the occupational and employee health operations of our corporate health system and government agency clients. Our intent is not to sell any of these capabilities on a standalone basis, but rather to share innovative components of the total enterprise health solution developed in collaboration with our client community. So today's webinar is focused on the work we've been doing to help our clients prepare for COVID vaccine mandates. While each client is configuring things a bit differently, we're going to blast through a high-level overview of features our clients are using to track vaccination status, collect proof of vaccination, manage exemptions, manage testing for unvaccinated exempt employees, and generate compliance reports. Today's agenda is simple. We'll start with a brief overview of Enterprise Health, followed by a short presentation of some of the aforementioned COVID functionality, and then we'll finish with a few minutes of Q&A if time allows. And before we get started, a few housekeeping items. We are recording today's session, and in a few days, we'll provide a video link via email. All attendees are muted upon entry to minimize background noise. And as mentioned, we'll try to leave a few minutes for questions at the end. So if you do have questions, please submit them via the Q&A feature in WebEx. That is being monitored by somebody, and we will get to that at the end again. So just a quick background on who we are. Enterprise Health, Enterprise Health is the only cloud-based health IT solution to combine occupational health and compliance, clinical care, and employee engagement on a single interoperable certified electronic health record platform, equipping enterprise clients and their employees for a healthier future. Those enterprise clients are primarily employers who operate their own on-site health clinics. Enterprise Health has been developed over time in concert with our clients. It all started when Dow Chemical called us out of the blue, looking for a web-based electronic health record application they could deploy scalably in their on-site clinics around the world. We showed them our software, they did like it, and they helped us develop the occupational health functionality critical to large employers. Dow then introduced us to other organizations like Eli Lilly and Company, who helped us add even more employee health capability to our software. This continued. Our first half dozen clients or so were referrals, and we had the good sense to develop whatever these leading edge clients asked for. 5 or 6 years later, people started telling us we had the most comprehensive occupational health IT solution available. We then expanded our functionality to serve clients in the healthcare industry, specifically large health systems that provide occupational health for their own employees and third-party health services. Our corporate clients span a wide variety of industries, including oil and gas and pharmaceuticals. In fact, Enterprise Health is the occupational health solution for many Fortune 500 companies, including 5 of the top 50. We also have a proven track record supporting the mission goals of federal agency clients. Today, our client list is an impressive collection of blue-chip corporations, health systems, and government agencies. We also have a full pipeline of organizations that have selected our solution and are in the contracting phase. So today's presenter is Emily McComb. Emily is our Director of Account Service. She leads the account management and application support teams to ensure each customer's success. So Emily, I will stop sharing and turn it over to you.
Awesome. Thanks, Kevin.
Yep.
Let me share my screen here. All right. So today I wanted to walk the team through kind of the various ways that our customers currently are handling their various COVID compliance measures. And I will say today, this really runs the gamut. We have very specific counties in California that have had their own requirements for over a year at this point, as it relates to collecting vaccination status, routine testing. The feds are kind of limping along and working through the courts and all of that as well with their own requirements. And again, certain cities in New York with very specific requirements, state level requirements. And so our customers are really kind of aggregating all of these different mandates and requirements across the country and really across the globe too. And we're going to show you some of the tools that they're using today to do that. Primarily, we're going to look at vaccine data tracking as well as a little bit on the exemption status as well, and looking at kind of the routine COVID test management, which we know, depending on how things work themselves through the court, that will become a huge, huge focus for a lot of our customers early next year. So first and foremost, a lot of the compliance programs that are being administered right now, they have a lot to do with where the employee lives and works. And so through the HR feed, we know where the employee works. In this example, Fred works in California, or lives in California rather, and we know where they work as well. So we can see here, they work and live in the same state. If there are specific rules about people who are working in specific areas, we can run those rules based on the criteria that we're getting over the HR feed. And we'll also know if they're working on site or if they're working remote, because we are sent their work location as well in a more granular form here. In this example, he works in building B, but if he was a remote employee, you may see that this says remote instead, so that using the information that comes through the HR feed, we're able to include or exclude people from vaccine mandate programs, testing mandates, things like that. So we have a couple of ways that our customers are collecting vaccine data. Primarily, they're collecting vaccination status on the employee portal, which works well because you're able to send out notifications to those populations to say, hey, log into your portal account and, disclose your vaccine status to us, and that works really, really well. In some cases, though, your organization may have different business units or, different portals in place depending on where they're at in the world, and you might need to kind of aggregate some of that information, and that has been fairly common too. So we do have a mass import tool we'll take a quick peek at as well, and then in some cases, we actually have such a large temporary worker population, or maybe a population where English is not the first language. And so there are just a lot of barriers with technology where we actually have folks who have set up kiosks in production facilities or in parking lots where someone can just walk up with their vaccine card and they can key in the information that they need off that card as well. I'm going to pop into the portal here really quick. Give me just a moment. All right. So this is just a sample employee portal in my test system, the Occupational Health Clinic. And on this portal, there's all kinds of different things they can do, like schedule an appointment, schedule a health screen. For our purposes, though, we want to look at reporting the COVID vaccine. So if I click on this button, you'll see here that the vaccine history is on file. And so they can see what's already been reported. So hopefully this will eliminate some duplicate data entry. And they can report if they have one vaccine received, two, or if they're just reporting a booster. And this is becoming much, much more common that we are collecting the booster information using the employee portal as well. This is really flexible, though, I will say. So if you need to, change how something is worded to suit your organization, or maybe you don't want to collect booster information at all, this can be taken off with, just a click of a button. It's really, really simple. And so in this scenario, let's collect 2 vaccines. So I'm reporting that I've received 2 vaccines, and we do allow for a split manufacturer to be reported. That is getting to be more and more common, where someone received maybe Moderna for their first dose and Pfizer for their second, or something to that effect. And you can see that, they have both options here. So we'll pick the Moderna vaccine, maybe was administered on the 1st, and then the second manufacturer, I could pick Pfizer, I could pick another, and that dose was given, we'll say, yesterday. They optionally can upload a copy of their vaccine card as well. So if you are really operating on the honor system, which some of our customers, frankly, are doing, where they're just collecting the vaccine information, but they are not verifying that against the vaccine card, it could stop there. We could have this whole section just completely turned off. But if you do want to verify that, or at least ask for the vaccine card to be put on file, then this section can be used as well. And you can see here that they can click this to choose a file and pick it from their laptop. But if they're on a mobile device, like a cell phone, an iPad, something like that, they actually can engage their camera through clicking this button instead, and then they can just snap a picture of the vaccine card. I have one on file here just as an example, just obviously a blank sheet of paper, but they can see here what's on file. And so if maybe they only had 1 dose on their vaccine card when they first reported that, and now they've received their second and they want to put a second one on file, they can go ahead and upload that here to replace this image. And then they would just click submit. And in clicking submit, There are a whole host of business rules that you can run at this point. So you could send an email to the employee to confirm that that's been received and let them know that their vaccination status was updated. Or you could place that into a queue to be reviewed. So maybe someone wants to look at that vaccine card and make sure it's theirs. Make sure it is a COVID vaccine card. Make sure that the data is true and accurate on that page. And then once it's made its way through that queue, then you want to send an email to say your information has been reviewed and we've updated your vaccination records to suit. So there are a whole host of audits placed on file. And with the employee portal, it's very common that our employers are sending out mass email communications that are automated through Enterprise Health. So again, identifying the right population who you want to go, or who you want to log into the portal to report their information using your HR feed. We'll send out those mass communications so that you're not doing that one by one, driving the employees to the portal, and then again, automating those notifications if that information is confirmed or reviewed to let the employee know that their vaccine history has been updated. The employee portal is completely web-based, so they don't need to do a download. We do have an app available in the App Store, but you don't have to deploy that. It is totally web-based, so it can be used on a laptop or a mobile device very, very easily, and that's a great feature there. I did want to touch on the exemption request. I have a screenshot here of what that would look like. That would be in addition to the item that we just looked at on the portal. This section could optionally display. So if you do have someone who needs to apply for a medical or religious exemption, you may have a section that looks similar to this. You may use different terminology, may ask the questions in slightly different ways, and this is really easy to customize. But, you know, if they need to apply for an exemption, then conditionally, these other sections could display here. And again, once that exemption request is received, it would land in a queue for review, and then we could automate the notification. So if that was marked as denied, we could automatically send out a message to say, your exemption request was denied. Please go to the portal and report your vaccination status when available. Or if it was approved, again, that communication would then say, your request for exemption has been approved, and we'll send you details shortly about routine testing or, you know, whatever is appropriate for your organization. So if the portal is not possible, you know, you can't deploy the portal because of the issues that we talked about, you know, significant language barriers or technology barriers. Again, you might have a largely temp population that doesn't have access to your network to log in to the portal. We do have an import tool that can be used that you can aggregate the data across the organization. So if you have, you know, different business units collecting the data in different ways, you can essentially package it up into a relatively simple spreadsheet and then import that through the control panel, and our engineers can help with that. And we're doing a lot of that. I mean, we have a lot of customers with, you know, many different business units doing different things. They have the autonomy to make those decisions, but we need to aggregate the information back into Enterprise Health. So we can certainly help with that. We also have a rapid data entry screen. So on the screen here, you can see that 2 Pfizer vaccines are being documented as just historical injections in the chart. It's really, excuse me, just a couple of clicks. You know, you would pick the COVID vaccine, pick the manufacturer, add in the series and the dose. If they had already received their booster, they could add that in as well and then just click submit. Really, it just takes a couple of seconds. And we do have some customers who have set kiosks up with really, really limited access security, or maybe a temporary nurse or someone temporary who was hired into HR. They really just have access to the screen. You know, they can search for the applicable employee by their employee ID, and then this is the only screen they get access to. They don't need access to the other areas of the chart, and so we can do some pretty limited security roles so that they can just manage the data entry this way as well. No matter what way you're collecting the vaccine status, it will update their compliance. So if you collect it through the portal, if you collect it through a mass import tool, if you collect it through the rapid data entry, getting that vaccine information on file is going to update their COVID prevention program status, which is essentially the vaccine panel status. So in this case, Inez was required to report her vaccine status. So she was made a member of the COVID prevention program. And once she uploaded her vaccine status, either through the import or through the portal, her status would be marked as complete. So now you can start to drive some compliance reporting where you can show everyone in a specific business unit or a specific building who has reported all of their status, or I'm sorry, reported all of their vaccines versus those who have not. And so it's, I think, really helpful to be able to collect the data in different ways and still be able to manage that compliance tracking. Once we know who in your system is vaccinated and who does not need to participate in the routine testing program, we can start to identify the people who we will need to send those routine reminders to get the COVID test done. And so again, we can use the mass email reminders for that purpose. What's been very common is that the first email that goes out is to say, hey, you've been identified as someone who needs to complete routine COVID testing. If you've not yet reported your vaccine status, go to the portal and do that now. And sometimes that's motivating, to get those people on the portal because they don't want to perform that weekly test. Or the email reminder might even go to the supervisors to say, we've identified, these 10 people who are going to be a part of the testing program. Please confirm with them, that they have not been vaccinated or something to that effect. We have built out the ability for employees to self-report the results of their COVID tests on the portal, which we'll look at here in a moment. And we've also built out a ton of lab integrations here recently to just collect the information from the lab. If your population is mostly concentrated to a specific geographical region, you may only have one lab that you're working with to process all of your COVID tests. And if that's the case, it's really simple to set up an integration with them and to get those results electronically rather than the employees either, bringing a copy of their results in or reporting them on the portal. So for the employees who will need to self-report rather than having the information come in through the lab, we can do routine reminders. If we've not received their results, we can send out a reminder to them to let them know that they need to log into the portal and report that. And we can also trigger those in a queue, like we talked about with the vaccine status, so they can land in what we call a task queue. And so the results that they import on the portal would actually land in a queue for someone to look at, make sure that they're not falsified, make sure that they're correct, make sure that they're negative, and then act on that appropriately and, approve those on a week-to-week basis. Let me pop into the portal and show you what that self-report will look like. So from the home screen here, I can click on the COVID test result reporting button. Again, super flexible to retitle things, name things just slightly differently if needed. They can pick the date of their test. Let's say I had my test collected on Monday. They can begin to type in, let's say, the word negative, and you can see it auto-completes for me. This will actually force them to pick either essentially negative, positive, or I think it was indeterminate is the other option. But it will pin them down just to specific answers there so that you can run rules on this. So let's say if someone does upload a positive test, you might want to get an email out to the supervisor, to make sure that they stay home from work or what have you. We do have name of reviewer here by default, and we are learning so much from our customers on how they're going to handle tests that the employee is self-administering. What we're hearing from most of our customers is that they need to be proxied essentially. So they'll either hop on a telemedicine visit or they may have contracted a provider group in their area to proctor the test so that they're, doing a telemedicine visit with a third party where someone's just watching them do the swab. Some folks might have an on-site clinic at most of their sites, and so they may have like a plexiglass screen set up at a kiosk where an employee can just walk up, self-swab, have someone watch them do that. And then in that case, if there's not an integration in place and you are having your employees self-report, they could put the name of the person who proctored that. So this is totally optional. Our customers are learning a lot about how they're going to do this. And this may change for you. This may be applicable or not, but we can list out a specific, list here in a drop down of the person who proctored that. If you need them to, document who watched them do their self-swab, if they are doing a self-screen. And if they are doing a rapid style where they have like a cassette essentially with the test result that displays on it, then you can have them take a picture. So same with the COVID card. If they are on a mobile device, this will actually let them engage their camera. So they can snap a picture of it before they throw that test away. Again, just so that you have some checks and balances to make sure that that was done. With the lab integration, we can certainly automate quite a bit on that front. So if we see that a specimen has not been collected in a given week, we can send out those reminders to an employee to let them know, hey, you've not come down to the lab, or if the lab is not on site, we've heard from the lab that your specimen has not been collected this week. Please make sure that's done by X date. And so we can automate those reminders and past due notifications with the lab integration as well. Most labs that we're working with at this point to collect the COVID tests, they are operating off of some pretty strict, very well-established technical standards like HL7. So generally speaking, those integrations are pretty quick. Now, of course, there are those holdouts that are doing something on their own, doing something different, but that's really rare this day and age. So most of the labs that we're working with can be integrated with pretty quickly. And also, like we talked about with the COVID vaccination status, regardless of how we're getting the test result, be it through the portal, through a lab, the compliance tracking is going to be updated within the chart. So you can see in this example, William Hart is due for, in his case, a rapid. You might be doing a different test, and that's totally fine, but they're due for a rapid. And once that result would come in either over the employee portal or through the lab, then this would be marked complete and their next due date would appear so that we know who's complied for the week and who has not. So just as kind of a reminder around this, you can automate the past due notifications for those people who've not complied with testing in a given, rolling 7 days or 1 week window, however you're looking at that. We can optionally as well send a weekly report to HR or whoever it's appropriate to send to for people who are past due. If anyone's work needs to be suspended, then we can either send a list of people to HR, or we can even give HR very limited access to Enterprise Health to run the report to find that information out. We actually can put that information on your supervisor portal as well. So if it is appropriate for the supervisors to assist in managing compliance on this front, they can actually have just a quick dashboard that they can get to on their version of the portal, where they can see a list of, all of the people who report to them and indicate the compliance for the given week as well, so that they can change shifts around for anyone who needs to be pulled out of work, help with reminders, and drive compliance that way as well. And then something that I want to touch on just briefly here too, we're anticipating that the numbers of employees who need to be tested is going to be quite high come, January, February, whenever these programs kick off. And as people who maybe were hesitant about vaccines become more comfortable with it, or frankly, just holdouts, people who just didn't want to report their vaccine status, when they get tired of going through the rigmarole of being tested every week, they're going to either choose to be vaccinated if that's, appropriate for them, or they're going to report their vaccine status. And so as they do that, as they would go back to the portal and report their vaccine status and that gets verified, we want the testing reminders to stop. We want the labs to stop getting those notifications to reach out to people for testing. And so when we receive their vaccination information, the test will stop triggering on their chart, and they'll be removed from the testing program and marked as compliant on the vaccine program. And we're being really careful that, with each of our customers, as they're kind of incorporating their own business rules and their own way of doing this, that we are making sure that when someone does become vaccinated, it does stop the testing program. So I just wanted to just kind of make that note here real quick. I think we have just a really short window for Q&A. I think we're at our 30 minutes, but do we want to open it up for a question or two?
Emily, I'll throw out a question or two real quick.
Okay.
First of all, certainly we know that all of this has been a bit of a moving target. Requirements change, it seems, every day. And as you pointed out, things vary by locality, by state, by country, by part of the world. Can you talk a little bit about kind of the flexibility of the solution to be able to handle, varying requirements, by client and by location?
Yeah, absolutely. So in Inez's example here, she was placed in the COVID prevention program because there was something within her demographic criteria that indicated she should be placed in that program. And that could be anything, I have the screenshot up here still, that could be anything from her work city to, her company code and anything in between. So the information that we are getting over the HR feed really is a gold mine. And we're able to create those rules to be really specific. And there are some that are very straightforward. If you work in building X, make them a part of the vaccine mandate. It might be much more gray. Maybe if this, then this, except if this, it might be a much more expanded statement, and that's okay. As long as we're getting that information over the HR feed, we can completely automate that away. And additionally to that, if the area is just so gray, or for some reason you're just not collecting the information in your HR system and we have to do it manually, we have some screens that allow that to happen pretty quickly on a manual basis. So if you've got 4 or 5 people that they don't meet the criteria, but they need to be tracked, the information is just inaccurate in the HR system or something like that, you can manually put them in and out of these programs as well.
Okay. And then one other question, there are multiple mandates out there. Certainly in the U.S., we have the Safer Federal Agency mandate. We have the OSHA ETS mandate. There's the CMS mandate for healthcare entities. But of course, they're all being challenged in the courts. So it's sort of a start and stop situation. Are you seeing that clients are kind of taking a wait and see approach and hanging back, or are people tending to go ahead and say, let's get prepared and be ready just in case when these things do come into effect?
That's a good question. Most of our customers are rolling forward knowing that the programs might be on hold and that they might, that hold might lift later. So I would say the majority of our customers are taking a much more proactive approach, and they are getting everything configured that they possibly can. And if there are just big questions that they absolutely cannot answer, we're just documenting those gaps and holding on that. But I would say for the vast majority of the customers we're working with, they're acutely aware that everything, for a time is sort of stalled, but they're pushing forward anyway, knowing that at some point that's in all likelihood going to be lifted and they're going to need to roll forward with the program and, no time to waste. So we've seen an incredibly proactive approach.
Okay, great. Thank you. Kevin, I think that's all the time we have for questions.
And so we do thank people for joining today and look forward to talking to you again. We'll mention really quickly that we are getting ready to post a full list of events on our website, enterprisehealth.com, for 2022. So look for an email for that coming soon. And thank you very much, everybody. Have a good day.
Thank you all. Thanks, Kevin.